So it was a simple cyst. It measured 8 by 10 by 12 centimeters. She underwent laparoscopic removal about a week later, and they found that it was a dermoid cyst on pathology. So she underwent a full recovery after that. But important when we get a case with a comprehensive ultrasound report that doesn't quite make sense, for us to really take a minute and think about it. As Mark correctly points out, bladder cysts are very uncommon in the pediatric population, while dermoid cysts are higher up on our pelvic cystic structure sort of differential. Okay, another case is a 17-year-old. She was visiting from the Ukraine, and she came in with abdominal distension and back pain for 3 weeks. She was vitally stable and afebrile and had a significantly distended abdomen with everted umbilicus and ascites noted on examination. I will add that her beta was negative. We did check that. We aren't irresponsible. So this is what we see. So what do you guys see in this picture?
It's a complex structure with septation.
Okay.
Surrounded by some kind of homogeneous
Something, right?
something.
Yeah, so it's a complex septated structure. It's cystic, but there's many pockets to it, and it's sort of floating in this homogeneous kind of thickened hyperechoic fluid, which could have a little bit of a sonographic appearance of blood or some form of complicated collection, right? You could see that with pus. You could see that with a variety of different things. Let's keep looking.
That's hydronephrosis.
Yeah, it's hydronephrosis. So this was a fast view, and there's also some complicated fluid between the spleen and the kidney there as well. So that was her CT that she underwent while she was here. And the diagnosis for her was likely mucinous cystadenoma. It measured 42 by 30 by 15 centimeters, and she had everything in terms of her lab reports were normal. The advice from the surgeons was that she return to Ukraine to seek further care because she'd likely need surgery, but then also probably an ongoing course of reassessments and rescans. She left to go get the care because she was vitally stable. So she departed later that week to go home. So the final points of today's lecture are really to think about practicing the views with a full bladder in stable patients so you can start to recognize and understand the anatomy. You want to understand the limitations of point-of-care ultrasound in diagnosing a myriad of cyst presentations. There's so many different types of cysts that can occur that you really don't want to hang your hat on something specific, but really point out those abnormalities to facilitate further care. What that allows for is timely consultation and advanced or cross-sectional imaging, and it can really help with cognitive load in differentiating the etiology of abdominal pain in patients where you do have those findings.